I didn't realize that. I've never been in a code where like they're still like awake and talking to you, so it was really confusing. No one's gonna be in the room and he just codes.
Look at his monitor.
Why do I always get the hardest scenarios in sim, guys? Like, if you watch any of my previous videos from simulation, you know I always get the hardest case, and it's unfortunate.
The name of your puppy? That's what I always hear. Everyone names their dogs Bailey. Can you tell us your name and date of birth? Okay, can you tell me your name?
Yeah.
What is it? What about your date of birth?
God born back in 1996.
Okay, and do you know where you are?
No.
You're in the hospital. You just had a heart surgery.
I'm just going to attach this close outside.
You do? Do you know why you're here?
I come to see you.
Oh, well, I love the company. Thank you.
And yeah, I'm going to put these heart beads, okay?
Okay, blood pressure 105/67. We're going to take a look at your chest wound while we put you on the monitor, okay? Do you have any pain?
My chest is killing me.
Your chest is killing you. Okay, can you rate it on a scale of 1 to 10?
Have you ever had a horse kick in the chest?
No, I have not, but I would assume it's not pleasant.
How would you rate it from 1 to 10?
Yeah.
Yeah? Like, you got a number?
You got some edema on your legs.
No one's gonna be in the room and he just codes.
Look at his monitor. Okay. So he's having
That's sinus check.
sinus check, but he just had PVCs.
I mean, just do cardio maybe?
I'm gonna listen to your heart, okay?
Whatever you have to
And then also, probably need to call the doctor to do another cardio version.
It's like, yeah, it's organized like that. There's like all over the place. Yeah.
Yeah, he's having sensitive visa. What's wrong?
I don't feel good.
We're gonna get the doctor in here to try to help you feel better, okay? We're gonna see if we can get you some medication. Oh, vagal maneuver. Do the vagal maneuver. I don't really know how to do it, but
No, tell him push down.
I'm gonna do something called a vagal maneuver to try to help lower your heart rate, okay? Unless I'm doing it right.
Maybe you can elevate this bed.
More. Sit you up so you can breathe better.
Okay, so we believe you might be going to VTech soon. So we're looking at rhythm.
He's having stints of VTech.
Fluctuating.
Doing a vagal maneuver.
So what we're doing right now, we're doing like a vagal maneuver, trying to keep his heart under control.
I need to tell him to act like they're breathing. That
Give a
draws the
butterfly
blood.
now too.
Like the easiest one, because I do it
Yeah,
myself.
I mean, it's, his heart rate
Very
just keeps on
dumb.
dipping and dipping. Like it's at 94 right now, when it was closer to 120 when we came in. Well, keep him around 90. Yeah. I mean, well, let me help you see if you get some vitals before you go. So, he's got blood pressure of 105/67, respiratory of 23. He did rate a very high pain rating, so he says he got hit in the chest by a horse.
And his A&O is like he's A&O times 1.
Yeah, he's a little confused too. ANO times 1, so he doesn't believe at the hospital or something like that.
Ask if there's any medication we can give for his heart.
Okay, in the meantime, do you have any recommendations? What is concerned about his heart?
VTech is the,
He's consistent VTech now. Check on him.
check his
Oh my gosh.
Remember when somebody said it happens when you're not in the room?
That was a long run though. Longer.
I'm surprised for the patient. Screaming and stuff.
In the real world, our monitor would be like beeping, right, like alarming, or like.
So that actually gets brought up every time. When somebody says, but your alarms would be going off.
Okay.
Yeah, the alarms would be going off. You're probably in another room with just.
It's like 2 milligrams.
Yeah, the alarms go off.
Right.
Or if you were on the silly floor, I'm not sure if
Can
he is
he?
supposed to be your silly
There's no
monitor
can.
room would be going, hey, no, we check out room 6, I'm going to be
I'm
chat.
asking, are you still in pain? My name is Gerard. We're at the hospital. Bailey's getting some pain medication. That's why I'm asking, are you in pain?
I'm getting you some medication to help your chest.
Right. Did the last nurse give you any pain medication?
Why do I have the shirt?
Because you're at the hospital? Anyway, we're gonna give you some morphine, okay? It should help with your chest pain.
What else can you do?
Okay.
How are you feeling? Is that helping at all? Doing some VTech. You want to do the vagal maneuver?
Mine was down to 97, 96.
Okay, should we,
Wait,
okay, do the vagal maneuver. I'm
Anthony.
gonna call the doctor.
Oh, he's still responsive so far. Do you know where you are? You're at the hospital, remember?
Yeah, he's still having stints of VTech, so should we call the doctor to tell him to come down again, or is he on his way?
He did say he was on the way.
Okay.
If you want to call him.
I don't know what else we can do for him without the doctor.
Let's see.
Yeah,
feel pretty about it. Okay? What do you want to do about it? Can you do that? I would call rapid response. And I would have a code card hooked up to this guy.
I don't know if we could hook him up
Oh, yes.
before.
Oh, yes. Put the pads on him, get him on monitor. Because one of these times that VTAC is going to go pulses. No, don't know. But I would, after I saw it like the first, maybe after the second time, I probably would have called rapid response.
When you saw the dip in the,
When I saw him go to VTAC,
oh,
I would call for some help.
Because I thought that if you kept going back into like sinus, that would do other things like the.
He probably needs an antiarrhythmic drug.
Yeah, and that, yeah. I was looking for amiodarone, but he didn't have an order.
That's why I would have experienced help up here. Call it rapid response. And then the amiodarone will find right in that top room.
Oh, okay.
Hi everyone, long time no talk. It has been a couple days since I last talked to you. Last you saw is I was taking the color out of my hair. So this is what it is right now. It's pretty auburn reddish color. I went and bought another like thing to do to take the color out. I just haven't had a chance to do it, so maybe I'll do that this weekend, I don't know. But anyways, I took my exam on Tuesday this week. Yeah, I took my exam and I passed. I got a 90%. So thankful that I got that. Like, I really was not sure what I was gonna get on that exam, and I passed. I got a 90%, which was like crazy. But I mean, if you guys want to know my study tips and how to study for nursing exams, I have a whole video on that on my channel that I just posted, so you guys can go watch that and get good exam scores like me, because obviously it's my study method it's working. I don't know. Also, like, I think it was manifestation too, because we had our instructor does these things called mindful minutes during lecture to kind of just like reorient ourselves and like ground ourselves and just kind of help deal with like stress and anxiety and all of that stuff, because you know it's crazy in nursing school. And so we did a mindful minute right before the exam, and she was like, it's been proven in studies that if you visualize and focus on the score that you want to get on the exam, that it will manifest and you will do better on the exam. You will actually, it's been proven, you will get that score. And so the entire time we were doing the mindful minute, I was literally just meditating, and in my head I was like, 90s, anywhere from 90 to 100, that's what I want to get on this exam. I was like, anything with a 9 before it, that's what I want to get on this exam. And then I submit the exam and I only missed 5 questions. Like, oh my god, it was like such a relief. Oh my gosh, it was such a relief, because that exam was really stressing me out. You know, the first exam of the quarter or the semester is always the hardest, because you don't know how your instructors test, you don't know how they're gonna lay everything out. It was our first exam of 4th semester, so I was like, it's not gonna go well. I was really not expecting it to go well, but it went really, really well, and I'm so happy that it did. And then, so you guys can see, I'm in my uniform. So we actually just got done with simulation. So we had our simulation, our second, well, we already had our like skills day, sim day type of thing. It was like half skills day, half simulation day. So this is considered our second sim day. And basically we go in and we're paired up with another student from another clinical group. So I had no idea who I was paired with. And we just get a brief history on our patient, and we have to go in and treat them. These are the mannequins that can talk and breathe, and you can listen to their heart and their lung sounds, and you can give them medication. And like, it was crazy. They actually like seize, like some of the scenarios that some of the students had, like the mannequin was seizing in them, which I thought was really interesting. I didn't know that they could do that. My patient ended up like somewhat being a code. He was day 2 post-op for a quadruple bypass, and he was having hypervolemia, so he was fluid overloaded, having kidney problems, and he was having edema, shortness of breath, crackles, and unstable VTAC, ventricular tachycardia. And basically, if a person is experiencing VTAC, if they're pulseless, you go right into CPR, defibrillation, giving those code drugs. If they have VTAC but they're still responsive and have a pulse, then you go into it's not less emergent per se, but it's a little, I don't know, a little chiller than going full straight into ACLS and CPR. It's called cardioversion, just basically where you synchronize the defibrillator pads to the heartbeat of the person, and then they get shocked with a lesser amount of electricity, so it's only 100 joules instead of 200 like defibrillation normally is. And it synchronizes with the heartbeat, so it shocks with the heartbeat to put someone back in normal sinus rhythm. So basically that had already happened to him, and then he started going into unstable VTAC again. And I've never dealt with something like that. Like I've had codes, but only pulseless codes. So going into this, like I knew that he wasn't supposed to be defibrillated because he still had a pulse, he was still responsive. But I was trying to do everything I could I was trying to think of all the interventions I could do as a nurse to help this patient. And we even called the doctor. He said he was coming for another cardioversion. But unfortunately, we didn't realize that we still needed to call a rapid, and we still needed to hook him up to the defibrillator, and we still needed to prepare for that, because in that situation it's most likely that they will eventually go to pulseless and unresponsive. And I didn't realize that. I've never been in a code where they're still awake and talking to you, so it was really confusing. And we've learned a lot of safety stuff surrounding AEDs and stuff, so you're not supposed to charge the pads until you're absolutely ready to shock and all this stuff. And so I was just thinking if he's responsive and has a pulse, we don't need to do that yet. And so we were just kind of running around with chickens with our heads cut off, trying to figure out what else to do while we waited for this freaking doctor to come and cardiovert our patient. So yeah, we were supposed to call a rapid and get him on the pads to start reading his rhythm, which we did not do. But it was fine. This is a learning experience, and that's exactly what it's for. You're there to make the mistakes so you don't make it on an actual person. So we all made mistakes, okay? It was definitely a letdown, because I went into it feeling like it was going to go really well, and then coming out of it realizing oh, I should have hooked him up to the defibrillator, I should have called a rapid, was really discouraging and upsetting. I almost actually cried once we left. I was oh my gosh, that should have gone so much better. But then when I got back into the classroom, everyone was that was insane. That was one of the hardest scenarios. Why do I always get the hardest scenarios in sim, guys? If you've watched any of my previous videos from simulation, I always get the hardest case, and it's unfortunate. But anyways, so yeah, and even the instructors were that was a really difficult scenario. We were surprised that that was given to you, and also they were it was because apparently we were supposed to understand based on the mannequin and what the instructor running the mannequin, Carl, what he was saying. Like, he'd be like, oh, what happened? And I just thought it was because he was confused. We assessed him in the beginning. He was ANO times 0. He didn't know what was going on. So I just thought that was because he was confused, disoriented. But apparently, according to my instructors, I guess that was Carl's way of like imitating that he lost consciousness during the episodes of VTAC, which it was not apparent at all to us that that was what was happening. And even the instructors, they were like, yeah, we didn't realize that he was like trying to tell you guys in less words that he went unconscious during the VTAC, which would have then we would have been like, okay, like this is more serious and we need to call a rapid and get him on the pads and everything, but we didn't do that. But anyways, it went as well as to be expected, you know. Like, I always get super nervous for simulation, but then once it's over, you're like, okay, that wasn't as bad as I thought it was gonna be. And it's always like the nerves when you're in there, your mind just feels so like flustered and you're like, oh my god, what do I do? And then you step out and you're like, oh my god, obviously we should have called a rapid. Obviously we should have like started getting him ready to code. Like, he would, like, even before we went in there, Carl had like hinted to us, like he was like, do you know how to use the code cart? Do you know how to use the code meds and all that stuff? And like, he like hinted that to us. We went in, and then I went into the sim room and like blank, just nothing. It was so bad. And even like, I had prepared for this. I knew he was going to be fluid overloaded. We should have asked the doctor to prescribe diuretics. That just like completely left my head too. It was bad. And also the person that I was paired with, I was expecting him to be a lot more hands-on, and honestly I was hoping that he would take the lead and tell me what to do so I could just follow him. And he did not do that. So I ended up having to be like the team lead and telling him what to do when I'm over here like, I don't even know what I'm doing. I don't even know if I'm like, if this is what we're supposed to be doing. Like, it was so bad. But then my instructor texted me afterwards and was like, great job on being team lead. And I was like, oh, that's exactly what I needed to hear, because it was definitely like nerve-wracking, and I just felt so bad after coming out of it. I was like, oh my god, come on, Bailey, like, you know better, you should have done better. But hearing that from my instructor, and also hearing that like everyone, including the instructors, thought it was a very difficult scenario, and they said like what we did, even though we didn't know what to do, we still went through interventions that we thought could help. We still tried to like do as much as possible, and they were like, that's exactly the initiative you need to have as a nurse. That's the critical thinking you need to have as a nurse. Like, just because you didn't know what to do didn't mean that you stopped doing interventions for the patient. Like, so I was doing like vagal maneuvers, which wasn't exactly for that particular rhythm on the ECG, but it did help. It did help for a second. His VTAC went away and he stayed in sinus TAC for a while. Then he went right back into VTAC, and that's just like our instructors, Carl's way of telling us like, hey, like there's something more you need to do here, like trying to tell us then we need to call a rapid and we need to get the code cart. But it was just going over our heads. But it's fine, guys. I'm still here. I'm still in nursing school. I didn't fail. So use my experience as a way for you not to feel as nervous or scared if you're going into sim for the first time, or even we do sim every single semester, multiple sims. I'm in my 4th and final semester, and I still freak out. I still get so nervous when it comes to sim, and like I shouldn't, because it's not that bad, you know? Like, we're all there to learn. We're all gonna make mistakes, and like I said before, like it's better to make them on the sim mannequin than on an actual patient. So just know that you can make mistakes and that it's okay. It's okay to make mistakes because that's how you learn. Like now I know, and I will never forget, that if a patient is going through VTAC like that, if they're having, so VTAC is PVCs, premature ventricular contractions, at more than 3 on a strip, like in a row. So I know if a patient is having VTAC like that, that I need to call a rapid and I need to hook them up to the monitor and I need to prepare for a code. And now I know, you know, and I'll never make that mistake again. And that is a life and death situation. So like, it's good that it happened here and not when I'm a new grad in the hospital and I'm like, oh, it's fine, I'm just gonna wait for the doctor to come and cardiovert him. Like, no, like let's call a rapid, let's set up for just in case, you know, you never know. And then also, once you call a rapid, you can start giving code drugs, which aren't always ordered in the patient's chart, and he really needed amiodarone. That would have been like perfect for treating his VTAC, but since he didn't have a order for it and we hadn't called a rapid, well, I wasn't gonna go to the code cart and take out some amiodarone, and because I don't know the dosage, you know, I don't know anything to do. Oh well, all the code drugs are pre-dosed, so I guess the dosage doesn't matter. But it's just weird to think about because that kind of feels like out of the scope of a nurse, because as nurses the doctors give us the orders and then we go and give the med. So as code drugs are kind of sketchy to me because it's like a standing hospital order, but not necessarily for the specific patient, because I mean, you're not like anticipating a code, you know? So it's just weird. But obviously, like, as I get more into my nursing career, as I get more... Abby! What the heck? I'm literally filming right now. Everyone say hi to my baby sister. She's a college student. I was like, oh my gosh, you look so familiar. Okay, hang on guys, I'll talk to you later.